All right, good evening, everyone. Thank you for joining us for session 4 of 5 in our Backyard Chicken Flock Talk series. To ensure a smooth presentation this evening, we kindly ask that you keep your microphones muted. At the end of the program, you'll be welcome to unmute yourself and ask any questions. But in the meantime, if you have any questions, please feel free to submit those in the chat box anytime throughout the program. This meeting is being recorded and will be uploaded to the Tarrant County YouTube page after editing, and that link will be sent out to everyone at that point in time. Our speaker again tonight is Dr. Greg Archer, and at this time, we'll go ahead and turn the program over to him.
Hey everyone, welcome back again tonight. I have informed the agent there that I will share this PowerPoint. So there's a lot of information in it that if you need it, don't try and write it all down somewhere, or you can try, but there's a lot of stuff I'm going to be going over tonight on different doses of certain medications that you can give your chickens that are maybe not what's on the label that have been given to me by a veterinarian. So purpose is that tonight, anything that I give you of a dose has been given to me by a poultry veterinarian and his recommendation for what to do that, what doses to give the animals. This is not from me, this is from a veterinarian. So just take that. So one of the important things we're trying to talk about keeping your birds healthy. The first step for that is going to be biosecurity. So that's going to be protecting your birds from getting a disease. So trying to stop whatever could possibly give them that disease, which was something we call vectors. Those vectors getting able to have access to your birds if you can. So that a vector is something that transmits a disease. So that can be anything. That can be rodents, other birds, insects, could be your shoes, could be car tires coming on your property, could be any equipment you may borrow or share from somebody else who has poultry. Could be friends or family members you have coming over to your house that also have chickens. Could be your pet. Could be the feed that you're giving them, depending on where you got it from. Could be in the water. Could be dust, just in the air. Anywhere animals get sick from things, they can get those things. So trying to eliminate as much as you can of these things from being exposed to your animal. So strategies to control these are basically trying to stop all these different things like viruses and bacteria and fungus and parasites, all the things we kind of may talk about tonight here, from getting them and transmission, especially from flock to flock. So if someone has a sick flock, you need to really take care not to be around those birds and bring it over to your bird. And sometimes you don't realize that those birds are sick, so you just want to assume that everybody else's chickens are sick and kind of stay away from them. Again, biosecurity is probably the cheapest preventative measure that you can do. Much more effective than trying to give them all these expensive probiotics or anything else that you're going to maybe try and give them. Just doing good biosecurity is going to keep your birds hopefully it's safer than you can do most of the other things. So a good biosecurity plan is going to have 4 components to it. The first one there is isolation. So trying to keep your birds away from other chickens, other birds if possible. Flock management is the next one. So that means you're going out there looking at your birds. You're noticing things. Do they seem sick? Are they not producing eggs? Are they sneezing? Are they watery eyes? Something seem off about them? Just you're going out there and managing it, and also keeping good water and feed and things, and keeping their litter clean and things like that, and the poop clean. Traffic control, like I said, controlling who comes around your birds, who gets to go out there in your coop, who gets to be around the birds, trying to control that. And then cleaning and sanitation is the last one. That's a really important step that you should do periodically throughout your birds' lives, throughout the year. And that's all going to be part of a good biosecurity plan. So the last one I talked about in there is cleaning, disinfection, sanitation. People maybe don't always do this right. So there's a 5-step method for this. So the first one is dry clean. So that's where you go out and you're going to use a bristle brush or a metal brush, depending on what you're going to do. And you're going to scrub off all the organic matter from stuff. You're going to get that all off as much as you can. Then you're going to use a soapy water to rinse your feeders or whatever, even your coop down. And then you're going to rinse it off with some clean water to get all that soap residue off. Then the fourth part is the key part a lot of people skip. You need to let everything dry off. Let it dry. Let it air dry in the sun or whatever. And then you're going to disinfect that by using either a quaternary ammonia or a bleach solution, a 10% bleach or some other disinfectant that you're going to spray on there. Because if you skip that dry step and you just did all this soap and rinsing, you're basically diluting your disinfectant because it's still wet. So you're not giving it at the effective dose, most likely. So then you're not killing off the stuff you're trying to kill off. So make sure you let everything dry, then disinfect it again, and then let it dry again after that. And then you can put your birds back in or give it back to your birds. I recommend and we kind of recommend keeping, especially wild birds, away from your flock. You say, how am I going to do that? There's not really much you can do, except if you have a coop, making the hole small enough that little birds can't get in there and let them free range. One thing you can do is if you're a person who also likes to have bird feeders, don't put bird feeders up where your chickens are also going around, because then you're just attracting wild birds over to be with your chickens, and you don't want to do that because wild birds are carrying a lot of stuff. That also goes for waterfowl. You don't want to let, especially the ducks, get near your chickens, or if you have pet ducks or anything else. You don't want wild ducks getting near them. So don't let your animals go down to the pond if you have a pond or some water on your property, if there's ducks around, especially because those ducks are carrying a lot of diseases they're going to give them. I have pets on here too, because your pets do carry a lot of stuff, and other people like to let their chickens free range with other livestock as well. They can give your birds fleas, worms, and some diseases as well. So if you're letting them out there and you're out there with your cattle in the pasture, they're going to be pecking in the cattle manure. But that means if your cows have worms, they're eating those worms and they're getting them. Then your chickens are now going to have worms too. Same thing for your dogs or your cats. If they have it, they get the same stuff. You can also get fleas really easy from other animals as well. Don't recommend training or buying uninformed buying. If you do get birds, make sure you quarantine them. Dedicated footwear and clothing, even going as far as if it's there's a lot of AI or some other disease around, wearing disposable boots and stuff like that. But mainly, I would recommend having some dedicated footwear and maybe some clothes that when you go take care of your chickens, those are the shoes you wear out there. One thing I talk to people about this is because if you go buy your feed from a feed store or wherever you're buying from, everyone's going there. And if you're wearing your same shoes that you're going in your coop there, you're tracking manure into that store, possibly disease, and so is everybody else. So then you're stepping in it, then you're bringing it back to your house. So really think about where you're going when you're going around with birds. You really want to have shoes that basically are hopefully disease free, that you're just wearing around your chickens. Then hand washing is important for your birds and for you, so you don't transmit the stuff to them, but also so you don't get some of the stuff we talked about before, like salmonella and other stuff transmitted to you. I would kind of recommend, especially during the migratory season, I would confine your birds as much as possible so they are away from those wild birds and ducks that are migrating that may be carrying diseases. I know sometimes it's hard because you want to free range. A lot of people want to free range their birds, but when you do free range them, you are taking the risk that they're getting exposed out there. So just be aware of that. I did mention screening your houses if you do have a coop or something, so wild birds can't get in there, making sure the holes are small enough that they can't fly through them. Avoiding contact again with waterfowl, as I mentioned, and restricting your visitors. If you also want to control the habitat for the attractants, like I mentioned, birds, rodents, other varmints, and insects, you don't want to be giving a lot of things for that habitat for them, like a bunch of trash or old equipment next to your chickens that they all live in. You want to reduce the attractants. You don't want to have a bunch of spilled feed or things like that where you're going to attract rodents and bugs out there, because those things do carry diseases as well, and then your chickens get exposed to it. So you want to try and keep everything as clean as possible. Another important thing is minimizing stress, because if we all know when you get stressed, you're more likely to get sick because it depresses your immune system. So making sure your birds have fresh feed, fresh water, good ventilation during hot weather so they're not heat stressed, that they're getting cool, and basically making the environment overall comfortable. So they're just comfortable, happy little chickens there, so they're not stressed out, because if they are stressed for some reason, whatever it is, could depress their immune system and lead to them easier getting sick from something. And as I mentioned, watching for symptoms, looking for your birds are coughing, sneezing, watery eyes, ruffled feathers, loss of feathers, excessive picking at each other, labored breathing, sudden drops in production and feed and water consumption. All these things may indicate something's wrong with your birds. If you see that stuff, these are going to be some of your first indicators. Maybe see what else is going on and maybe be concerned that your chickens have something going on. The last key this little on the hairline, I tell people, and a lot of people don't like to hear this. My opinion is if you get a sick chicken, it's better for the rest of your flock to eliminate that bird, or if you have non-productive birds that aren't doing real well, get rid of that bird. I know it may be your pet or your favorite chicken or whatever, but if it's sick, you can pay a lot of money to a vet trying to treat it, or maybe some of the things I'm talking about, but it may be best to get rid of it before it spreads that disease to the rest of your flock, and then they all die, and then you have no birds left. So sometimes it's best to sacrifice that one bird for the rest of them to hopefully survive. Especially if it's pretty ill. You're most likely by the time a chicken shows you that it's really sick, it's too late because they are a prey species, and birds in general show sickness really late into the sickness. So by the time you are seeing it, they've been sick for a while. So it's not just like it happened yesterday. They've been sick for a decent amount of time, so that they may not make it. I am going to tell you about the medications, but be careful with any medications. Don't over-medicate. Follow the label or the off-label instructions that I give you here. If there are withdrawal requirements, make sure you follow those. If there aren't withdrawal requirements, and I'll go over that in a minute because they haven't been tested in poultry, my recommendation is probably don't eat the eggs for at least a couple weeks to make after you stop giving the medication to make sure that that's out of the bird's system and they're not putting that into the egg because you don't necessarily want to be eating the medication you're feeding them. And then try and use products that are approved for poultry, but I will show you there's a lot that aren't because of the fact that in order for them to get it, somebody has to pay the companies that make these products to test them in poultry and find the appropriate dose and get it approved for use in poultry. And generally that falls on like a commercial industry. And a lot of things I'm going to show you, especially some of the parasite stuff, there hasn't been a need for it because chickens have been raised for the last 50 years in cages mainly, so they haven't had ground contact or gone outside like you guys are going to be raising birds. So that's why, because the smaller flock owners aren't paying for these big companies to test their products in proven poultry. So the ones that are ones that usually like may have a commercial issue, so they've gone and done it. And the last real thing I remember, literal is good, doesn't mean a lot's better. So do not give a ton of medication just because this little bit will make them better. So let's give them a ton of medicine because you can actually maybe kill them or make things worse by doing that. So this is an old map. One of the things I want to talk about here, this is the avian influenza map. This is, as you can see, this is from November 22 to 23. We had we still have an outbreak going on now. It's still out there pretty heavy, but you can see, and eventually this state turned green too. And I believe West Virginia too, it did too. So every state in this country has basically had avian influenza in it. We haven't had an active case, knock on wood, this year. In poultry, there has been some cases in Arkansas and Oklahoma. And there's been a lot on the West Coast, a lot on the East Coast, and a lot up here with the darker greens as well. Avian influenza is probably going to become more of an issue again because the ducks are getting ready to migrate. And we've already had some migration. They're starting to migrate. So when they migrate, they spread it around the country. So as they start moving around, that's when we're going to get avian influenza. So it's been a big problem. As you see, even during that big outbreak, then we had a lot of backyard chicken flocks that had it. But generally you see is it goes down as the colder weather starts to happen. But then when it starts to get warm, it starts to go back up again. But then during summertime, it will go back down again. Because it's following that migration pattern of those birds, but it also does not like to live above 95 degrees. The virus doesn't do well. So usually, again, knock on wood, Texas, we're usually not as bad affected, but the problem that's been happening in the last year has been dairy cows are carrying this virus now. And there's lots of dairy cows out here in West Texas, and that's where we've had some positive stuff about a year and a half ago or so. That's why it's spreading so bad, because it's actually jumping to other species. You may have heard the one earlier this year that a person in Louisiana contracted it and then they died. They were an elderly person who had other issues, so they probably didn't die necessarily from avian influenza. It's just they got a flu, like any other flu can kill you if you have other complications. But the people who are going to be at risk to have it jump to you are people who have chickens and work around chickens. So be aware that is something that is out there. It doesn't kill the dairy cows right now. It just makes them lose production. but it does kill chickens like crazy. If your birds get avian influenza, they're probably going to die almost your entire flock within a few days if they get it. So if your birds start getting really sick and dying, call the Texas Animal Health Commission because they need to come out and test your birds to see if they have avian influenza, and then they'll take next steps to try and mitigate the spread of it. It's basically the only thing we can do right now. It spreads like any other flu through bodily fluids, so it's mainly being transmitted through fecal matter. It can also be if a bird sneezes. There's actually some evidence now that it is possibly being spread on the air, so in the wind. So that's pretty scary if that's how it's going around, because we can't. We thought that airborne transmission was highly unlikely, but there's actually some research showing that might be actually happening now. If you see it, the main one is going to be sudden death, but a lot of the other stuff, if your birds look like this, they may have influenza. But if you have a bunch of birds start to drop dead, you probably have it. Contact someone so they can come out there from the Texas Animal Health Commission. If you have any diseases, I recommend talking to a veterinarian. I am not a veterinarian, so I will say this: I can help you with lots of questions by contacting me or calling our office or emailing me. I am not a veterinarian, so technically I am not allowed to diagnose your chicken. So sending me pictures or calling me on the phone saying my chicken's doing this, I can't really do it. I'm not a veterinarian. I can't diagnose them. Lots of the diseases that you'll see in a few slides are very similar, so it's hard to tell. One problem with this is most veterinarians do not know anything about chickens, because if you're a veterinarian, you go to school for 4 years, you spend maybe a week talking about birds, and it's not specifically about chickens. If you want to become an avian or a poultry veterinarian, you have to go through an additional 1.5-year program at certain universities that offer that. It's basically getting a master's on top of your veterinary, your DVM there. So there's not a lot of them out there. The one I will say, and I will give you his name here in a minute, works at a diagnostic lab here in Texas, the Texas Veterinary Medical Diagnostic Lab. They have a couple of them who are poultry vets there, and you can sometimes contact them and they can help you with questions like that. The one I'm talking about he's located in Gonzales, Texas, but he'll answer questions for the whole state. His name is Dr. Ficken. If you call there or you email his email here, he usually will help. But he has helped a lot of backyard chicken, and I think he enjoys it to help people who maybe have some issues. If you also have birds that are dying, you can look on their website. There's a way to send them the actual dead bird. They want it packaged a certain way. They don't want them frozen. They want them refrigerated. If you're going to have to refrigerate it and send it to them, and for a fee, they will do a necropsy on it and try and determine why it died. Do some tests on it. If they can figure it out, they'll tell you if they find a certain disease that caused it. Okay, so now into the diseases. So this first one is called mycoplasmosis. It's a bacteria. It's the most common disease in backyard chickens. What happens to them is they get respiratory rales, they start coughing, nasal discharge, they get conjunctivitis, so like you see in that one chicken's eye there. They also get sinusitis, which is the bottom picture there. They get really swollen up sinuses, and then watery eyes. That can lead to a secondary bacterial infection. Often it's cholebacteriosis. Usually it's an uncommon infection, and it's usually not fatal, but it can be sometimes, but usually it's not. Usually it's just you get this really sick chicken like this. They have to diagnose it using a PCR or serology for antibodies, in a blood sample and looking for antibodies that show that the chickens have an immune response to this bacteria. How you can treat this, there are 2 ways to treat it. If your birds have this, you can either use Tylenol or you can use Lictamycin. How to mix them here is listed here. Like I said, I will share this with the agents. You don't have to try and copy it on, but basically, you see, the Tylenol has a withdrawal time of 1 day in chickens and 5 days in turkeys. So if you give this to your chickens for the week, it says here, following that, do not eat the eggs during that whole week, and then do not eat them for at least 1 day after you stop giving it to them. The Lictamycin has 0 withdrawal time, so you can technically, I guess, be eating the eggs while you're giving it to them and eat them right after. I might wait myself. If you get a sick chicken, I don't think how much I'd want to eat eggs from it anyway, but both of these go into the water, and then you let them drink that water, and then they'll be treated with that, so that we'll get rid of that mycoplasmosis or treat it. Another one that kind of looks similar as I said, they look similar. This one also has the sinusitis thing, as you can see, and coughing, stuff. They will get sinusitis, and sometimes they have a discharge that is like honey-like in consistency. So if it comes out, it's like real thick and honey-like on this. But again, it's the only way they do this is they take a bacterial culture of that sinus material, that honey-like stuff, and then they can culture it and see that and get this bacteria and see that's what it is. It's really hard to tell the difference between this one and this one sometimes. The nice thing about it is it's the exact same treatment. So if you're treating your birds for Coryza or for Mycoplasma, you're going to be using the same thing. So you'll get rid of either one of those if they happen to have them. So again, same treatment there. Another one that they could get, and we hope they don't, is infectious Sclerotitis or ILT or LT. This causes similar stuff with respiratory areas, coughing, conjunctivitis. They may start coughing up mucus and blood. It can be acute in onset and spread throughout your whole flock, or it could be a chronic disease that just kind of stays there and you have increased mortality and a lot of excess mucus from your birds. This one is one of the reportable diseases. So if your birds get diagnosed with this, the veterinarian has to report to the Texas Animal Health Commission. The reason that is because we are trying to keep this out of Texas. So if a bird gets this, they're going to want to probably come and kill your whole flock off. Because we do not want to get this spread throughout. But as you can see, they get these really bad lesions in the larynx. It doesn't look good. That's how they look at it. So again, because this one is a reportable disease, you're not going to treat this. If your birds get this, they're basically going to want to kill your birds. They're not going to want you to try and make them better. I mentioned this cholevexosis as a secondary infection from the mycoplasmosis. It is caused by E. coli. It's common in mortality in poultry. Mortality secondary, as I mentioned, it usually ends up with birds being really depressed and lethargic, having ruffled feathers, being dehydrated and reluctant to move. Again, this one can also be on acute and sudden onset, or it can be a lingering thing that causes birds to slowly lose body weight. They do have lesions. These are, if you were to cut a bird open, all these little white spots, places, and things like this are lesions on the different organs. It usually is an infection at the hatchery. So usually you get birds that already have it, and there's real high mortality in your young chicks and poults in the first few days of life. So it's possible if you get a bunch of birds, you get chicks in the male, and they all die when you first get them, and you were to open them up and they look kind of like this, kind of gross inside. It's most likely that they got this because they were having basically an E. coli infection that led to this. You can treat it if they aren't dying, the ones that aren't dying, with tetracycline in the water. You can get it's basically 2 to 1,000 milligrams per gallon of water. And the reason there's such a range there because it's dependent on the severity of the infection. If you're having a really bad infection in your flock, you're going to want to give a heavier dose than the other. And again, there is a withdrawal time. You get this one for a week, but then there's a day withdrawal time after you give this tetracycline because you want to let the antibiotic get out of their body before you start eating the eggs. Another one that can happen is Marek's disease. This induces inflammation and neoplasia, which is basically cancer. It's a really horrible way for a chicken to die. There are three different serotypes of it, so 3 versions. It's an infection that's produced on the feather follicle and is shed in the dander of the chickens. So they contaminate the environment once they have this, and the virus remains infectious for several months at room temperature, or for a lot longer, for years of refrigeration. So how they get it is they inhale that dander from the other chickens, and it spreads that way. So once it's in the environment, it's kind of spreading around, and it's just kind of out there, and they keep spreading it to each other because one will shed to the next one. Again, it affects almost any organ system and then spreads throughout that. It depends on the virus strain, the genetic exposure rate, things are going to happen. You also may see some paralysis. The birds may not be able to move. They may go blind. They may have poor doers, like they stop laying eggs. The paralytic and nervous system ones are you observe usually in birds that are over 4 months of age. The neoplasia effects usually appear after 1 year of age, so they'll start getting those cancers after about a year. Once infected and recovered, birds are going to shed indefinitely. So even though they may recover, they're going to shed that virus and infect all the rest of your birds. So if one of these birds gets it, it's better just to get rid of it, like I said earlier. They're going to diagnose it by looking at necropsy and histopathology of the organs and look at it because they're going to have all these little weird, the organs aren't going to look normal. like they should deliver here and the other organs in its body there. The good thing about this one, it has a vaccine. A lot of the hatcheries will have it on there as an optional vaccine. I say get it. Some of them may even have language to discourage you from vaccinating your chicks from them. Pay for this vaccine. They can give it at 1 day of age. If they don't, you can buy it and give it to them when you first get them and give it to them. But they can give it in ovo in the egg when they're being incubated. It's really easy to give it to them. If you have to, you just got to inject them a little squirt into them. The problem with it is if you buy this on the internet, it comes in doses that are for a minimum of 1,000 birds. So, and it only lasts for 2-3 hours once you combine these two things. So you're buying a whole lot more vaccine than you'll ever need to do your flock. So I would say just have the commercial hatchery. If you're buying it from a mail order place, do it. If you're buying chicks from like a feed store or something, ask them where they got their chicks from, because maybe they can know which hatchery and what they're vaccinated for. Make sure this one, if your birds are vaccinated for, you don't want to get this, as I said. Another common one that you may want to vaccinate for that birds can get is fowl pox. It's like the chicken pox in people. It goes through mechanical transmission. So basically, mosquitoes bite one bird, suck the blood up from a positive bird, go in and bite another bird, and they transport the infection that way. It can be from mild to severe depending on the infection rate. It can lead to secondary infections, blindness, respiratory distress, things like that. It can occur at any age. I recommend giving this as a showing of a pox on the comb of a chicken. It looks like this, little crusty little sores. This is a really bad case, is where I say blindness, because all the pox grew so much this bird can't see. It's swollen its eye shut from the pox. This is inside of a bird's mouth. These are pox inside of its mouth. Lesions in there from the pox. This is going down its throat. So you can get lesions inside the throat, makes it hard to swallow and eat and things like that, compared to a nice normal one. There is treatment and prevention for this. You can use the vaccine to treat as well as prevent. If you have an outbreak, you can give it, as I said, it's a wing web vaccination. It's really easy to get or do. It basically is a little, I'll show you the next one. You stab inoculation in about 70 days, should resolve. You should have resolved the issue in about 14 days if you give it to them. The vaccination should be done about 4 to 6 weeks on birds. If you live in a place where there's lots of mosquitoes, you should do this to your chickens, vaccinate them. The booster dose is recommended at 6 weeks of age. You can give it to them as they're older too. If you haven't done it yet, you can go on and vaccinate older birds for it. They don't have to be the young. You can do it older and just follow the directions. It's a stab vaccination. So you get a little fork little thing like this. You mix these together and then you dip it in there and then you stab them through their wing web. So the part of their wing that is basically just like not muscle or anything, it's just like a web, the little skin material, you just stab right through their wing, and that's how they get vaccinated by. It's really easy to do. I definitely recommend doing this if you live in an area with lots of mosquitoes. So I talked the other day about coccidiosis, getting the feed, getting the medicated feed, because usually it's caused by an Emeria species. It's usually transmitted by fecal transmission, and then they eat it. The life cycle is about 4 to 6 days. It can be mild to severe, can actually kill a lot of birds around 3 weeks of age. That's when you see it mostly. They're going to look kind of ruffled, feather depressed. They may have bloody droppings, may have some of them dying. This can also be secondary Clostridial infections can occur, causing this thing called necrotic enteritis, which you really don't want your birds to get. But again, it looks like these are the lesions on the intestines. These are the white spots, showing that that's basically showing that this bird has coccidiosis. You don't want that. You can treat that, like I said, by having the medicated feed, or if you don't, you can buy one of these things for oral solutions, and you can give it in their water for 3 to 5 days. You can also, in severe outbreaks, treat them with a slightly double the dose, and they can continue it again at a lower dose for an additional 1 to 2 weeks, and there's no withdrawal period for doing this. You can also try sulfamexidone at these doses here. Chickens and turkeys have a slightly different one, but you can do that for 6 consecutive days, and then this one has a 5-day withdrawal period. But you can do that, but the easiest way to do it is just give them it in their feed. Like I said, the medicated feed in the young, and then hopefully you won't have to deal with it later. But if you do have an outbreak, you can treat one of these in the feed. You can also give the Samproium in the feed instead of the water. They do sell versions of it. There's also a lot of other ionophores and chemical things that out there that it can be used. Again, but some medicated feeds, like I said, are already going to have this Ultralium has a coccidiostat in them. So feed the mitigated feed when they're younger to avoid this problem. Okay, so now I'm going to move to parasites. So internal parasites, your chickens can get lots of things like roundworms, tapeworms, threadworms, fecal worms. They can have the symptoms of all of these are going to be things like weight loss, diarrhea. You may actually see the worms in the or segments in the feces. It's really be a common complaint that birds eat normally or even eat voraciously, but they don't gain weight or they seem to be losing weight. They're eating a lot, but they're just getting skinnier and skinnier. It could be that they have these because these are taking all their nutrients away from them. So roundworms look like these little guys here. If you have those and tapeworms, if you've never seen a tapeworm, sometimes you can actually get these tapeworms pretty gross because they travel through the body all over the place, and you can actually get an egg with a tapeworm in it. Threadworms are a little harder to see. This is a microscope kind of showing it. They're little skinny, tiny little things. They're harder to see. Cecal worms will be in their ceca. These little tiny little worms will be in part of their intestine tract and their ceca. You'll get little worms in there. They live in that part of their body. Worming treatment. So you can get Wazine or Peprazine. It can treat roundworms if they have those. You can treat every 4 weeks until they're 16 weeks of age. At 4 to 6 weeks of age, for each 100 birds, you're going to put about 1 fluid ounce of that in 1 gallon of water. And at over 6 weeks of age, for about 100 birds, you're going to use 2 fluid ounces. So it's not a lot of this stuff in the water, because obviously you guys aren't going to have 100 birds. You're going to have 10 or less. So you have to do the math to figure out how much to put in there for how many birds you're going to be giving water to. But you can treat roundworms if they get that. Tretinoblazine or Safeguard, sometimes it's called, can also be used. This will do roundworms, cecal worms, and then Dr. Ficken, who gave me this stuff, said probably would also treat threadworms. Again, the label dose is 1 milligram per kilogram of body weight per day, so you got to figure out how heavy your birds are, and then figure out how much to do based on their average body weight. And then you can treat them for 5 consecutive days. It is stable in suspension and comes in, you can get it in 1 liter and 1 gallon sizes, but this one is kind of expensive, so it really depends on how much you want to pay for it. It is approved in laying birds, however, for egg production, and there's no withdrawal period. So if you want to get something that's approved in layers, you can pay a lot of money for this, and not have to have a withdrawal period. So now I'm going to get into the ones that are not approved for poultry. You'll see non-producing birds up here, but Dr. Ficken gave me these, saying that this would also would work. So you can get the Safeguard 10%, Panacur 10% product. It will treat all these 3 worms. You can mix it at this rate here and give it for 3 consecutive days, he says. It does settle out of water, so you have to make sure it's mixed up. He says, and it's not approved for poultry, so this is an off-label use by a veterinarian telling me what to do. So this is not approved, so I would make sure you don't eat the eggs during this or right after, because we don't know how long if there's a withdrawal period. So wait 2 weeks or more before you start eating the eggs, but this will be a way to treat them. You can also use ivermectin either as an oral or topical administration. Again, this is off-label stuff, so you can get that ivermectin 1% injectable or generic one, and you can administer about 0.1 mils for 10 bodies of body weight orally, so you can squirt it in their mouth, or you can pour 5 milligrams per milliliter on and administer it topically, so you can basically put it on their skin and treat them that way, because it'll go through their skin. So you got to make, not just on their feathers, make sure you pull back their feathers and put it actually on the skin, kind of like you would if you were giving your dog or your cat one of those flea medication things. Make sure you get it on the skin. And then you can measure twice per year if you need to, or more often if necessary. So you can use this as a routine worming to try and get rid of all types of pests. But it's not approved in poultry. Ivermectin is also going to be used as a topical one for roundworms, threadworms, gapeworms, plus a lot of external parasite. And you can do the same thing twice a year or more if you need it. But it is not approved in poultry again. There are some other ones out there. He didn't give me dosing, but he said these ones may also work for worming birds if you wanted to try them. But he didn't give me a dosing on them, so I don't know how much to tell you on what the dose. If your birds get external parasites, so this is another thing you have to worry about, is fleas, lice, and mites are very common in poultry. Your birds are going to maybe seeing them lose weight. We may actually see the parasites on them. They may be nervous or scratching. if they get too much of an infestation of any of these, they can die because these things are drinking their blood, so they can make them become anemic and die. One of the most common ones I hear about, people call are fleas, especially the stick-tight fleas. So these are them all over chicken's face. They're usually found in the skin and wattles of birds. They can survive and live on other animals as well. So if your birds get stick-tight fleas, they can go to your dog, your cat, your horse, your cow, and even you and your kids. So they can get on you. The common way to do this, to treat them, is using Sevin dust. So you can go out and get some Sevin dust and expose it. Apply it all over the face, wherever the fleas you see them on. Spread it all over your litter to kill any fleas that are living in the litter. You want to alter the alternative to this is to use petroleum jelly. So if you didn't want to put Sevin dust all over the face of this bird, go get some petroleum jelly and just smear it really heavily on all the fleas. And what basically that does is it suffocates the adult fleas, so they die. But that doesn't kill any eggs that are newly hatched mites. So what you're going to have to do is keep doing that every time they appear until you get rid of all the adults, so that you're not basically, you're going to have to keep killing off the life cycle. So I would kind of recommend if you do that, spraying some Sevin dust around in the litter as well to try and kill any eggs that are and little baby mites that are around everywhere else in your coop. Another one that you may see is lice. So this is some lice stuck to the feathers there. They lay their eggs on the bird's feather, typically near the base of the shaft. The bird may seem really irritated if it has them, and may have damaged feathers because they're trying to get the lice off. The lice do not leave the body of an infected bird except when they move to another bird. So they don't go off onto you. They just live on the chicken. Clinical signs may also include reduced feed and slow growth and declined egg production. You can use a lot of different insecticides, some like Prozap or Insectrin dust or Poultry Guard or even ivermectin, as I mentioned a minute ago. If you don't want to use one of those, you can find an organic insecticide that has chrysanthemums as a base, and you can spray that on your bird and on the lice, and that will also work as well. Northern fowl mites is a common one. These are the most common external parasite found in poultry. These usually live on under the wings and near the vent, and this is basically either some of them, but also all their feces that you see here. Treatment for them is similar to the other stuff, either that kind of dust or Poultry Guard or ivermectin, or using a chrysanthemum-based organic insecticide, spraying it on them. You can also use Sevin dust. I mean, this is Insectrin dust, but you can use Sevin dust as well. I do that a lot. If I've seen it, I just basically pick the bird up, put a whole bunch of Sevin dust on, everywhere I see the mites, on just cover the bird and its feathers. Do that until basically you don't see them anymore. It doesn't hurt the bird to use Sevin dust. It's the same kind of stuff that you put on your vegetables in your vegetable garden to kill off pests. So you're going to eat your tomatoes after that. So it's not really going to hurt you. The scaly leg mite is also one you can see. This is a microscopic thing of it because they're kind of hard to see on the bird. The rest signs you can see that these are is because the bird's legs become really thick and crusty. They can even lose toes if the blood supply gets cut off too much. So to treat these, you should use ivermectin. If you want to use a non-insecticide method, you can coat their entire leg with petroleum jelly or dip their legs in linseed oil. These ones are actually also maybe in addition to ivermectin, because they can add some moisture to their scales on their legs. It's going to help them because the scaly leg might really dry their legs out and can cause them issues. They prefer these mites prefer to live on the birds the entire time. So but they can survive off the bird. So it's not necessarily that they're always going to be on the bird. They may survive in the environment as well. Just a common chicken mite. We don't see them. I mean, they also be out there. They live in the floor nests and on the floor house and on the birds. They crawl over them. Again, if you see mites, it's the same kind of treatment. You can use this stuff we've already talked about, but you may have to also treat the house, their coop or whatever, every 4 to 7 days. And then added, you may need to treat these for up to 6 months because they can survive for about 6 months without actually feeding on a chicken. So if you get these mites, maybe not having to feed it. These are called red mites. We don't have these as much in the U.S., but if for some reason you got them. Some people want to use some other things to treat them. Sulfur dust. People try and make little bags that basically and hang them in their coop so the bird's going to bump into them and then they get dusted by bumping into them. That may work. or you can make these little dust bags and directly pat or put sulfur dust on your birds, or put sulfur directly in the litter. Those have been shown to work well on a lot of the parasites that I just showed you, the external ones. There are some organophosphates that you can use, like Rabon or Rabomac, that you can also spray on the birds and in the environment. I mentioned other types of, like pyrethrin also works. Spraying just a pyrethrin insecticide all around and make sure you get it. But if you are doing these things, make sure you are, if you 1 gallon of these kind of things usually does about 100 birds. You want to have a relatively good pressurized little pump sprayer up to 75 to 125 psi. After the birds are treated in the entire field, so you should also be treated, and you want to spray everything until it's saturated where you're getting runoff. So you're really getting everything soaked with these insecticides. Again, 1 gallon of this would do about 100 square feet, so a 10 by 10 coop, 1 gallon. You mix it up, should do it. Again, direct spray on the cracks and crevices, anywhere you think those little parasites may be trying to crawl in and hide. You want to not give them anywhere to get there. And then you want to treat the birds in the entire twice, about 14 days apart if you're using either of these 3 things, I should say. You want to do it 14 days apart. So you want to do it today and then come 2 weeks later and do everything, your birds and the whole premises all over again. Some people ask about garlic because they read stuff about garlic being good for parasites because it has a few compounds. If you look on literature out there, allicin, arginine, and methyl trisulfide have some antibacterial and protozoal activity. They may be effective, garlic, but I have no idea how well, because no one's done research on using garlic to get rid of this stuff in chickens. So while it may work, I can't tell you how well it'll work. It may work just as great as these other things, or it may not work at all. Diatomaceous earth is something a lot of people read on the internet and are like, I want to use this stuff. It's great. It's great. It can work. The idea behind it is it's a really fine powder. People put it in dust bags for the external powder, or they put it directly on the birds, or make a dust bath for them to use. Some people put it in the feed for internal parasites. You should wear a respirator when you are using it because it's so fine it can get into your lungs and cause problems. I would say the efficacy is questionable. So the idea behind the diatomaceous earth is, especially in the external parasites, is basically gets onto their exoskeleton. So, like a parasite's basically like a bug. So they have an exoskeleton, this outside thing, and it's supposed to basically act like sandpaper so that it makes little holes in their exoskeleton. And when that happens, if you do that to a bug, that you make a hole in its exoskeleton, it allows air to get in there and it dehydrates them, and they basically dry out from the inside out and die. So they have to get their rub on there. I've been part of some studies that we've used diatomaceous earth in laying hens to see if it would be effective. What we saw was more effective for helping a chicken remove external parasites was to have an intact beak. If they have a pointy beak, they did a much better job of pecking the parasites off themselves and each other than when we put diatomaceous earth on them to kill the parasites off. So they had a good, nice, sharp beak. They removed more parasites than the diatomaceous earth killed off on them otherwise. I talked about probiotics in the feed thing. If you want to get, most of your feed's going to already have probiotics in it. If you want to get probiotics, especially after any of the antibiotics that I listed earlier in this talk, that's probably a good idea to repopulate their gut with some healthy bacteria to try and stop some bad bacteria from getting in there. Otherwise, it's not really good, but it's, again, if they got a healthy gut, it's not much you're doing with probiotics, just going in one end and going out the other end to spend money for no reason. But if you think your birds are stressed or going through something, or you just gave them antibiotics, it may be something to help them keep them healthier. I've mentioned some other issues. I mentioned the E. coli infection, air sac infection from poor air quality. If you're not keeping your coop clean, or it's too dusty outside or something like that, it may get some air sac. Ammonia irritation. If you're not keeping your litter nice and dry and and you're allowing ammonia, if you smell ammonia in your coop, you got some problems. You shouldn't be smelling that. So wet litter ammonia can actually cause irritation to their feet, to their bellies if they're laying in it, and it gets higher up levels. It can cause blindness in chickens. It can cause them to go blind. I mentioned the coccidiosis. If you keep your litter clean, you're most likely, hopefully, going to avoid this, especially if you already gave them some medicated feed when they're little, and you keep your premises clean of this, you hopefully won't get it. for vaccination, like I mentioned, I recommend at least Merrick's and Fowlpox. Some other diseases that you may want to vaccinate for would be Newcastle's and infectious bursal disease. Those are the two other possibilities to get vaccinated either when they're chicks or later on in life. So these four are the main ones that I would kind of focus on if you're going to vaccinate your birds for anything. Vaccinate them for these four. There's lots of resources beyond this on the internet. USDA has a whole Defend Your Flock resource that talks about biosecurity, signs of illness, because you have a lot of other resource stuff out there on how to keep your flocks healthy. And also, if you're looking to see, like I showed you that graph earlier, if you go to the USDA's websites, you can find where the avian influenza is. You can actually they show you where it is in wild bird populations, where it is versus in chickens, where it is in other species as well. So you can kind of see where it is at the moment, where the positives are, and see if it's moving towards where you are. Hopefully it's not, but if it is, if you get I mentioned reportable diseases, the one I mentioned earlier. If you have a bird that gets diagnosed with any of these, you need to contact the Texas Animal Health Commission, because we do not want these in Texas. So if your bird gets any of these, they're going to want to come depopulate your premises and clean it and disinfect it and tell you can't get birds for X amount of time. I know that seems like a pain in the butt, but it's going to help everybody else on this talk that they don't get these things. There are some more reportable diseases, but these are just some of them. If you get diagnosed, your veterinarian should know which ones to report. But if they don't, they're listed on the Texas Animal Health Commission's website. So that is it for me in health tonight. Are there any questions that I can answer? I see a chat question, but diatomaceous earth, the treatment for lice. It will work on external parasites, like how I mentioned. It's the idea behind it is that it's going to desiccate them, so it's going to cause them to dry out from the inside out if they get rubbed on enough. Whether or not diatomaceous earth is going to work at all is not really certain. So it may work, it may not work. There's some other things, like I mentioned, some of the other treatments for lice are more certain to get rid of the lice on your birds than diatomaceous earth is. I know some people want to be more natural. But sometimes using things like that, a chrysanthemum-based natural product will work and kill off the parasites just as well, and probably better than diatomaceous earth, and won't be as expensive. Diatomaceous earth is not cheap. Are there any other questions? Anybody want to unmute and just ask me if they need them?
Yes, feel free to unmute yourself if you've got any questions at this time.
I know there's a lot of information. It's mainly about trying to keep your birds safe. Right now, the biggest threat to your birds is avian influenza out there. You've probably seen it. That's why egg prices are so high. Like I said, right now we haven't had it in poultry in a year and a half or so in Texas, but it is out there. I know it's I've heard it's in the wildlife. It's been in the turkey vultures and the vultures, the buzzards out there. They've been testing positive in Texas, so those are out there eating something dead that obviously has avian influenza, and then they're getting it and dying or carrying it. So they are testing it. It's in the state. It's everywhere around us. I mean, just because we haven't had it in poultry doesn't mean it's not here. It's here in Texas. So just keep your birds safe if you can. That's the main thing. All the rest of this stuff is basically if you keep your birds healthy and relatively happy, hopefully you aren't going to see any of these diseases. The other stuff I mentioned. It's usually if you're not maintaining your litter or you're exposing your birds to stuff that they shouldn't, like not taking the biosecurity precautions, that you're going to get your chickens sick.
Excuse me, you mentioned the chrysanthemum. You said that's the filler for the coop. Can you recommend a good chrysanthemum dust thing for the coop?
I can't think of any trade names for it, but if you look on some of the organic pesticides, they'll list chrysanthemum as like the active ingredient. Those are, if you get one that's like, as long as it's chrysanthemum based, it works really well on bugs and parasites, external parasites. It kills those off pretty well. And they're pretty inexpensive compared to some of the other stuff too, usually. So if you can find there's a lot of different trade names out there that have that in it. Usually you can find it in the pest control section of like a big box store, like a Lowe's or Home Depot, or in your Tractor Supplies or other stores like that, or Walmart's or wherever that sells that kind of stuff.
Thank you.
All right, are there any other questions? Well, if not, we will go ahead and conclude the program for tonight. Our last program within the series will be Thursday night at 6. The link for that program will be sent out at about 3 o'clock that afternoon. That way it's at the top of your email inbox for your convenience. So with that being said, again, thank you for joining us tonight. Please be sure to inform anyone else who you think would benefit from the programs moving forward, and we will see y'all Thursday night.